Let me ask you something honest. Have you ever felt that moment of panic when you know you're getting close, but you're not ready for it to end? You're not alone. In fact, studies show that nearly 1 in 3 men report feeling they finish too quickly at least some of the time. But here's the truth no one tells you. Lasting 30 minutes or more isn't about willpower or just thinking about baseball. It's a skill. And like any skill, it can be trained. In this video, I'm breaking down 10 proven research-backed techniques that real men use to control their endurance, satisfy their partners, and enjoy sex without anxiety. No gimmicks, no pills, just methods from pelvic floor physiotherapy, sports science, and cognitive psychology. Let's get into it. Why 30 minutes? Setting realistic expectations. First, a quick reality check. When people say last longer, they often imagine constant high-speed thrusting for half an hour. That's not healthy or realistic for most men. The average intercourse session from penetration to ejaculation is about 5 to 7 minutes. So when we talk about 30 plus minutes, we're including everything: kissing, touching, oral, position changes, breathing breaks, and sensual pauses. The goal isn't endurance for endurance's sake. The goal is control. You want to be the one deciding when you finish. And with the right techniques, you absolutely can stretch a satisfying sexual encounter beyond 30 minutes without feeling like you're in a marathon. Technique 1, the stop-start method, Masters and Johnson. This is the grandfather of all endurance techniques, developed by sex researchers. Masters and Johnson in the 1960s, it's still one of the most effective. How it works? You or your partner stimulate you until you feel you're about a 7 out of 10 on the arousal scale. Close, but not at the point of no return. Then you stop all stimulation completely for 20-30 seconds. Let the sensation drop to a 3 or 4, then start again. Why it works. Ejaculation isn't a light switch, it's a ramp. The stop-start method trains your brain to recognize the early warning signs and gives your sympathetic nervous system time to calm down. Over weeks of practice, your baseline arousal becomes lower, meaning you can handle more stimulation before reaching the edge. How to train it? Practice alone first with masturbation. Once you can reliably do 3-4 stop-starts over 15 minutes, introduce it during partnered sex. Your partner may need reassurance. Explain that stopping is a compliment to how good they feel, not a rejection. Expected result after 4 weeks, 2x to 3x longer endurance. Technique 2, the squeeze technique. Where stop-start is about pausing, the squeeze technique is about actively reducing arousal. How it works. When you feel ejaculation is imminent, you or your partner squeezes the head of the penis, specifically where the head meets the shaft, firmly for about 3 to 5 seconds. Not painfully, but with definite pressure, this should cause the urge to ejaculate to drop significantly. Why it works. The squeeze temporarily compresses the urethra and reduces blood flow out of the erectile tissue. More importantly, it sends a strong sensory signal to your brain that overrides the go signal for ejaculation. It's like hitting a reset button. Pro tip: use this only when absolutely necessary, maybe once or twice per session. Overusing it can make you anxious. Combine it with stop-start for best results. Success rate: clinical studies show the squeeze technique reduces premature ejaculation severity by over 70% when practiced consistently for 8 weeks. Technique 3, pelvic floor, Kegel. Exercises: you've probably heard of Kegels, but most men do them wrong. Let's fix that. How it works. Your pelvic floor is a hammock of muscles running from your pubic bone to your tailbone. When you stop urine midstream, that's a Kegel contraction. But for endurance, we care about 2 things: strength and relaxation. Why it works. During ejaculation, your pelvic floor muscles contract rhythmically. A weak or tight pelvic floor leads to premature, uncontrollable contractions. By training these muscles, you gain voluntary control. Even more important than squeezing is learning to consciously relax your pelvic floor during arousal. That delays the ejaculatory reflex. How to train correctly. Find the muscles. Try to stop peeing only once to locate them. Don't do this regularly. Do quick flicks. Contract for 1 second, relax for 1 second. 10 reps. Do long holds. Contract for 10 seconds. Relax for 10 seconds. 10 reps. Most critical, practice reverse Kegels. Gentle, intentional relaxation. Imagine your pelvic floor dropping and expanding like a deep belly breath. Do this 3 times per day. You'll feel results in 3 to 4 weeks. Technique 4, deep diaphragmatic breathing. This sounds too simple. It's not. Most men unknowingly hold their breath or breathe shallowly when aroused, which spikes heart rate and triggers the sympathetic fight or flight system. Ejaculation is a sympathetic nervous system event. To delay it, you need parasympathetic activation, rest, and digest. How it works. Breathe deep into your belly, not your chest. Inhale for 4 seconds, hold for 1 second, exhale for 6 seconds. The longer exhale stimulates the vagus nerve and lowers heart rate. Why it works during sex? When you feel yourself climbing toward climax, take 3 slow, deep belly breaths. You'll feel the urgency drop noticeably. This gives you time to think, move differently, or shift positions. Practice this daily. Do 5 minutes of diaphragmatic breathing every morning. During sex, use it as your secret weapon. Your partner won't even notice. They'll just see you staying calm and present. Technique 5, edging delayed ejaculation training. Edging is stop-start on steroids. It's the preferred method of tantric sex practitioners and is used by many men who want multi-hour control. How it works. You bring yourself to the edge of orgasm, the very brink, level 9 out of 10, and then back off. Not stop completely, but reduce stimulation to a very slow, gentle touch. You ride that edge for as long as possible. Why it works. Over time, edging increases your brain's tolerance to high levels of sexual arousal. The first time you try it, you might only last 30 seconds at the edge. After 2 weeks of practice, you can stay at an 8 or 9 for 5-10 minutes. After 2 months, you control the edge like a dimmer switch. The golden rule, never go past 9.5. If you pass the point of no return, you've lost the training benefit. Stop, reset, start over. Session structure. Week 1, 10 minutes of stop-start, back off at level 7. Week 2, 15 minutes, bringing to level 8. Week 3, 20 minutes, riding level 8 to 9. Week 4, introduce edging during sex. Technique 6, cognitive distraction, the 70-30 rule. Here's a counterintuitive truth. Trying too hard to last longer makes you finish faster. Why? Performance anxiety activates your sympathetic nervous system, exactly what triggers ejaculation. How it works. The 70-30 rule says spend 70% of your mental attention on the physical sensations and your partner's pleasure and 30% on something neutral. Not boring, neutral, math problems, a work project, naming NFL teams alphabetically. Why it works. Complete distraction kills arousal, but zero distraction lets you climb too fast. A small, steady mental side task lowers your arousal by about 15-20%, just enough to extend time without losing the fun. Examples that work. Counting backwards from 100 by sevens. Mentally reviewing the plot of a movie you just watched. Doing multiplication tables in your head. Caveat, don't check out completely. Stay present. The 30% is background noise, not the main event. Technique 7, desensitizing aids, used correctly. I'll be straight with you. Lidocaine or benzocaine wipes, sprays, and condoms work. They reduce penile sensation. But most men hate them because they overdo it and end up feeling nothing. How to use them correctly. Apply a tiny amount, half a pea, only to the frenulum, the sensitive underside where the head meets the shaft. Wait 10 minutes. Then wash off the excess with soap and water. You'll retain 70% of sensation, but gain 3-4 times longer endurance. Why this works better than full coverage? The goal is to lower sensitivity in the most reflex-triggering spot, not numb the whole penis. By washing off the excess, you avoid transferring numbing agents to your partner. Progression plan, first 5 uses with spray wipe, next 5 uses without, but keep the same rhythm and confidence. Long-term, use only occasionally, not as a crutch. Technique 8, the slow down, speed up method. Most men think stamina means sprinting the whole time. Wrong. That's how you lose control. This technique is borrowed from distance running. Vary your pace. How it works. You set a rhythm. Say 1 thrust per second for 30 seconds. Then you slow to 1 thrust every 3 seconds for 15 seconds, then speed up again. The variation prevents your nervous system from habituating to a single arousal pattern. Why it works? Your ejaculatory reflex is partially rhythmic. If you do the same motion at the same speed, your spinal reflex starts to anticipate and trigger climax. By constantly changing speed, depth, and rhythm, you keep the reflex guessing. Try this pattern. 20 seconds, slow, deep thrusts. 10 seconds, shallow, fast thrusts. 15 seconds, full pause. Keep kissing or touching. Repeat. This alone can double your time. Technique 9. Full body physical conditioning. Here's something most sex advice ignores. Your cardiovascular fitness directly affects ejaculatory control. A guy with a resting heart rate of 80 BPM will reach the arousal cliff faster than a guy at 60 BPM. Why? Because his baseline sympathetic tone is already higher. What works best? HIIT, high-intensity interval training. 20-second sprint, 40 seconds walk, repeat 8x, improves heart rate recovery. Heavy compound lifts, squats, deadlifts, strengthen the core and pelvic floor simultaneously. Yoga, specifically hip openers, pigeon pose, frog pose, and deep squats. Tight hips, use tight pelvic floor, use faster finish, the 4-week minimum, 3 cardio sessions, 2 strength sessions, 1 yoga session per week. After 1 month, your resting heart rate drops 5 to 10 points, your pelvic floor relaxes, and you'll notice the difference in bed. Technique 10. Partner communication and position strategy. This is the most underrated technique on the list. You cannot last 30 minutes if you're in your head, afraid to speak, or using the wrong positions. How it works. Before sex, have a 2-minute conversation. Say this: I'm working on lasting longer because I want us both to enjoy it more. If I slow down or change positions, it's because I'm trying to give us more time, not because something's wrong. Why it works. That single sentence removes 90% of pressure. Without pressure, your nervous system stays calmer. With calm comes control. Position strategy, high control, woman on top, she controls pace, you relax pelvic floor. Medium control, spooning, less intense stimulation, easy to pause. Low control, avoid early, doggy style or standing, most intense, fastest finish, pro move. When you feel close, say, let me switch positions, and take 10 seconds to move. Those 10 seconds of no stimulation reset your arousal clock. Putting it all together, your 8-week training plan. Don't try all 10 at once, that's overwhelm. Here's a realistic progression. Week 1-2, daily Kegels, plus reverse Kegels, 5 min. Your deep breathing before bed, 5 min. Stop-start during masturbation, 3x per week. Week 3-4, add edging, 2x per week. Add 70-30 mental distraction. Start HIIT workouts, 2x per week. Week 5-6, introduce squeeze technique during partnered sex. Practice slow down, speed up. Have the partner conversation weeks 7-8. Combine all techniques. Reduce desensitizing aids if used. Track your average time. You should be consistently over 20 minutes. By week 8, most men can comfortably reach 25-35 minutes of varied, enjoyable sex without anxiety. Common mistakes that kill progress. Let me save you frustration. Avoid these. Mistake 1, practicing only alone. What works solo is different than with a partner. Transfer your skills early. Mistake 2, focusing only on duration. If you last 40 minutes but your partner is bored or sore, you've missed the point. Good sex ends when both people are satisfied, not when a stopwatch says so. Mistake 3, ignoring your partner's needs. Some women don't want 30 minutes of penetration. Use fingers, mouth, toys. Mix it up. Mistake 4, getting frustrated. You'll have bad days. That's normal. Progress is not a straight line. When to see a professional. These techniques work for over 85% of men, but if you've tried consistently for 3 months with little improvement, see a urologist or a pelvic floor physical therapist. Conditions like prostatitis, hypertonic pelvic floor, or low serotonin levels may require medical treatment. There's zero shame in that. Final thoughts: endurance is freedom. Here's what I want you to remember. Lasting longer isn't about being a porn star. It's not about ego. It's about freedom. freedom from the anxiety that whispers, don't mess up, freedom to enjoy the moment without clock watching, freedom to give your partner the experience they deserve. Pick 2 techniques from this list. Start tomorrow, practice for 2 weeks, then add a third. By the time you've worked through all 10, you won't recognize the old version of yourself, the one who rushed, panicked, and apologized. You've got this. Now go train. Like, subscribe, and comment.